this meeting. This is our monthly CDSMP statewide collaborative meeting for November 5th, 2015, and this meeting is being recorded. So welcome, everyone. We'd like to go through our list of who is here. And let me just go down the list. So fast. I can't forward it again. Oh. When it's paused for a while. All right, so let me just go down who I know is maybe on the call and just introduce yourself and where you're from. We'll start with Holly.
Hi. Sorry, this is Holly
just
from
introduce
Weld County.
Yourself and where you're from.
From Weld County, AAA.
All right. Thank you, Holly. How about Melissa?
Okay, this is Melissa from the Boulder County AAA.
All right, welcome, Melissa. Let's see, we have Glenda. Glenda, are you there? I know sometimes folks mute. How about Monica?
Hi, it's Monica from the San Luis Valley, Alamosa, AAA, Region 8.
Great. Thank you, Connie. Sorry, Monica. The next name is Connie Young.
Yes, hi, Connie Young from the Department of Human Services, Division of Aging and Adult Services.
All right. And Glenda, were you there? I know we missed you. She's showing up, and I know she said hello earlier. Let's see, I have Ellen. Can you introduce yourself? Ellen? Okay. Are connections okay for everyone? I know also we have Kelly Jackson with COA.
Hello.
Kelly's actually calling us from San Francisco.
It's true. Dedicated.
We're all jealous. Who else is maybe on the call that I missed? Ellen, are you there?
Yeah, I just got here. Sorry for being late.
No problem.
Thanks.
Just introduce yourself and where you're from.
Oh, I'm sorry. Like I said, I'm from Larimer County. I work for University of Colorado Health at the Poudre Valley Hospital.
Great. Welcome.
Thank you.
And then I'm going to give Glenda another shout out.
Yes,
Glenda Mitchell.
Mary Pat. Can you hear me?
Yeah.
Mary Pat. Oh, okay.
Yes.
Thank you. I just managed to disconnect myself. Glenda Mitchell at the Center for African American Health.
Thank you. I'm glad you reconnected yourself. We're glad to have you.
Good morning, Mary Pat. This is Meredith from Telegen.
Oh, great, Meredith. Okay. That was Meredith Koob from Telegen is joining us. Was there anyone else we missed? All right. I'm going to go ahead and move on then. Here? Yeah, it should be a white area. There we go. All right, so we have some updates. Our format of our meeting this day is going to be slightly different because we do have a guest speaker. We're excited to have Renee Callanan join us at 9:30. So Connie's going to give us some updates in this first part of the meeting, and then we'll move into Renee. She'll pretty much take up the last hour, 9:30 to 10:30, with her PowerPoint presentation and some Q&A time. So, Connie, why don't you go ahead and address these issues that I have up here on the PowerPoint. Anything else?
Okay. Okay, will do. Thanks, Mary Pat. As you probably remember, Kelly McCracken from the Colorado Department of Public Health and Environment sent out, can somebody take their phone off a speaker? There's a bunch of background noise, if possible. Thank you. I know it's so, I love listening on speakerphone myself, but it's hard. But anyway, on the data collection that you all do, the forms that you collect from participants and have been submitting to CDPHE, we're figuring out how to handle that now, and I hope to have that all decided by our next conference call. Right now, Kelly did send out an email to folks asking who would be willing to continue or to submit data to NCOA, and there were several people that said they would be. I didn't hear from everybody about whether you would be willing to continue collecting it, and I'm hoping everyone will. NCOA is really interested in having that data for national purposes, and we could also use that for our state level efforts at state level sustainability for CDSMP that we'll be working on in the next year. So anyway, I will get with the people who offered to help with that and see, work out the details of that, and hopefully be able to respond to all of those questions next time. In the meantime, as far as I know, it's still okay to submit the data to CDPHE, to Lori Scott, as you have been. I am waiting to hear back from the supervisor there to see if that's still okay, but if it's not, then we'll regroup in the short term. But at this point, go ahead and send those in to Lori Scott. Oops, I clicked off my screen here. Any questions about that? Okay, sustainability planning. What I wanted to just mention here is that as part of the small amount of money that we carried over into this sort of extension period of our grant, I was looking at how we could use the small amount of money that isn't already committed to another project that we didn't finish last year, how to use that uncommitted money to the best purpose to try to sustain the program long term. And it occurred to me that with a webinar that was done by Maryland nonprofits several months back about how to develop a local sustainability plan, that perhaps we could use some of that funding to support those of you who are interested in developing a sustainability plan for how, looking sort of big picture at what you want to accomplish, what resources you have, what you would need to maintain and expand the program, and then how to do that. So it'd be a process of looking at your goals and seeing how to reach those and putting all of that on paper. So I'm going down the list of contacting everybody. I have talked with Ellen and Holly and Melissa. I'm glad that Monica and Glenda are on the phone, because you're on my list to follow up with in the next couple of days. So you could be thinking about that question of, do you want to expand? Do you need help or need to do additional things to try to sustain what you do have? And would you be interested in using that process that was that the training for which was provided on that webinar that Maryland nonprofits did? And that if you didn't participate in that webinar, I believe that would be available on the selfmanagementcolorado.org. Is that right, Mary Pat? Oh, you know what? It might not be, but I have it. I have the link if it's not there. So the purpose of this is really to support you all in seeing what you can do at your local level to help support your programs. I don't need I would like to have the plans, and I'll submit those to the feds, but it's not for me. It's not as a requirement for the grant. It's meant to be a meaningful process for people who, want to expand and sustain and are willing to go through that process and put into place whatever they come up with. As part of that, I talked with Mary Pat yesterday about COA has so much success in doing this kind of thing with a variety of types of organizations, medical practices, some employee wellness programs, and others that I asked Mary Pat if she thought COA would have the resources and the interest in offering to help in whatever way they can with local organizations, license holders that want to develop these plans. So, you know, what that would look like could vary from one license holder to another, but there could be a consultation on the phone, review of a draft, suggestions, ideas, that sort of thing. But I think it would, I'm hoping it would be something that some of you will be interested in doing, and we'll see the value in, and that'll be helpful to you in the long run. And if you're interested in having COA's support and feedback on that, then I think that could be a good way of tapping into their expertise and you know, building some collaboration within our group, the collaborative, building more collaboration within the collaborative. So I don't know if, since Glenda and Monica haven't heard me talk about this before, if you have any questions or comments about that, and if you have more detailed questions here, obviously, we can obviously talk afterward, but do you have any reactions or comments or questions at this time?
This is Glenda, and
somebody came off the speaker. I'm hearing a lot of background noise again.
Sorry, I'm not going to.
Were you trying to speak, Glenda?
Yes, I am in a room full of noisy people, so that's why.
Oh. All right, we'll do the best we can. Go ahead.
But I would be interested. I need to bring my program coordinator on board. She's trying to come up all of this, and I think we will be able to definitely look at the presentation and see how we might be able to join this together, especially since we're still doing the same process for the diabetes prevention program, and they have linkages, as we know.
Okay.
Yeah.
That sounds good.
Yeah. Mm-hmm.
Maybe we could have a conference call with the three of us, and you know, if Grant wants to join as well. But would that be possible in the next couple of days, do you think?
I'm not going to schedule for Grant because they have announced his successor. So I would definitely talk to him about it, and I'm sure that's going to
Oh, he's leaving you?
Yeah.
Oh.
Yes, he's his last day is going to be December 18th, and then the new director comes on December 15th.
Yeah. Oh. Yeah. Well, hopefully you get a new person, but never got to meet Grant, but he seemed like a great leader and all that, so I'm sure it'll be a loss in that respect. But for you and I and your new person, that would be great if we could set something up to talk a little bit more in depth about that. But I'm glad you're interested.
Sure, I sure would like to. Okay, thank you.
You could, and just briefly, if you want to send me some times that the two of you could do it. I don't have a lot of meetings the next few days, so I should be able to meet whenever you're available.
Okay, then I'll definitely send some times for us.
Great.
Okay. Thank you.
Great. Thank you. And Monica, Monica, did you have any questions or reactions to that idea?
Well, yeah, I'm definitely interested. And, you know, so if we can maybe definitely set something up for this next week.
Yeah, the sooner the better. Because I have some other, I'm sort of holding up some of the arrangements with COA for what they're going to do, and in terms of, you know, anyway. So yeah, and you could send me times that you're available to. Sorry.
Whatever works with you guys. I know that my schedule has been totally uprooted for a while, so kind of been up and down here. But I think next week, pretty much anytime, and the mornings probably look like they're a little easier for me. I don't know how it feels with you guys, but we'll get together, Connie, and I'll send you, you know, times.
That sounds good.
And we can kind of just do it that way if that's okay.
Yeah, great. Okay, that sounds good. All right. Any other questions about that?
Connie, this is Mary Pat. I just wanted to mention, in response to something you just said a little bit earlier, it is possible for us to post the sustainability plan. Is that what you were alluding to on the self-management?
The webinar that, sorry.
Oh, or did you mean the Intelligent webinar?
No, the one that Wendy Wolf did from Maryland Nonprofits.
Oh, okay.
I do have a link for that. I don't know, maybe that didn't get sent to you, but I will find it and do that.
Okay.
If it's either a link or if it's, yeah, I'll have to see what format it is. And I think it's a link, but anyway, I will send you whatever we have so that people can look into, watch that again or for the first time.
Connie, this is Monica again. Yeah, I'd like to just review that again also, just kind of a refresher.
Yeah.
It's been a little while, so yeah, if I can get that too or something, then I'll
sure.
Just kind of review it again.
That sounds good. And Glenda, that might be helpful for your new person as well. But.
I had a question about extension period money. We've got, all of the reporting that we needed to submit to the state. We had a couple of classes as well as to we had a
that was kind of funny.
Glenda's out on a street corner right now, it sounds like.
Oh.
Sorry, are you talking about the participant data? Glenda? Whoops. Now I can't hear you. Glenda, are you still there? Because we can't hear you.
I see you're on, but
oh,
I'm not sure what happened there. Shoot.
Yeah.
She hasn't gone off my screen, but
yeah, Glenda, if you're there, chime in whenever you can, and if not, if you're still there, you can send me an email with the questions after the call. So the last item is just to mention again that we want to offer an in-person meeting that would be a combination of looking at what we're doing at that point with state level sustainability for the program and getting some input from all of you. And I don't have all of that lined out yet, but really would like everybody to be part of that and know what's going on and provide input and that sort of thing. And then so that'd be approximately half of the day, and the other half that we talked about before briefly was having COA do a presentation about sustainability. And so that would kind of be another piece of how they would provide some of their expertise to everyone. This would be a group training / meeting versus what I was talking about a few minutes ago with working with individual license holders one-on-one. So some of the same information, but depending on how much time, we may also either in that training or maybe on one of our calls have some other folks talk about what they're doing in terms of sustaining this program. For example, there's someone at the CDPHE that works with the Falls program, and she's done some interesting things already with her program. For example, working with Parks and Rec centers to offer the classes, the Falls classes for a regular fee, and so that generates income and obviously and helps sustain the program. So is that something you'd be interested in hearing about, whether it's in this in-person meeting or on one of our calls, how she's doing that?
Well, this is Mary Pat, and I would say, sure, we always embrace having someone else share and give us new ideas. I think, is this Sally Thorson?
Yes.
Earlier?
Yes.
Yeah. So I think she'd be great, whether it's on a call or in person. I think the in-person, you and I spoke a little bit about that schedule. It might get a little tight, but
yeah,
certainly
that
a
probably
would be to have her at a meeting.
Yeah, and that probably isn't a really long presentation. So yeah, why don't I check with her and see if we would have time on the next call. I could see if she's available then, or the one after that.
Okay. Other thoughts that people have?
If you have an idea and feel like you want to mention that about your level of interest in having the presentation from COA about what they're doing, what they have done, so that you might be able to see if there's additional resources, additional organizations, or that you might want to reach out to for providing classes. Is that something that anyone on the call has interest in? Is that a no?
I'm sorry.
Yeah.
This is Meredith. I was trying to get myself off mute, but I'm definitely always interested in sustainability topics. So thank you.
Okay.
Connie, this
Okay.
is Monica. Oh.
Monica, yeah, go ahead.
I was just going to say, I think, just speaking for myself, or for us here in the Valley, I think we're kind of at a point where, I don't know, I mean, I think all this is great, and I really need to hear all this, because I think we've kind of hit a stumbling block somewhere, and we need some oomph, I guess, if that makes any sense.
Somewhat?
I'm sorry, somewhat?
We just kind of, we've kind of hit a stumbling block here in the Valley, where we just need some ideas and stuff. We've just had a lot going on here and stuff, and I think hearing all this and having, attending these and having people kind of build you back up again, just to kind of relight that fire is really great. So I'd say, all the ideas and everything would be wonderful.
Okay. Well, everything won't apply to everybody, but and people can participate or not. Yeah, but I am trying to use the time that we have and the resources we have to focus as much as we can on how to keep the program going, since obviously we don't have additional grant funding in the future to support what y'all are doing and all the good work that you're providing to people who need the class. So I will talk to Sally about doing presentation, and then work with Mary Pat about topics for that training. And just kind of a couple items that Mary Pat and I talked about for next call would be ways to partner among different license holders to increase reach and sustainability. This won't work for everybody, but COA has done some of that, and some of the license holders have paired up to reach get enough people in a class to offer one, and that offers less. You reach more people for a little bit less effort, I guess. But anyway, we can talk about that next time. And also, another question that came up from a couple different places was how can participants be supported in continuing to work on their goals and stay healthy after the class. So I don't have answers to that, and I'm hoping that we can have a discussion, and you all could think about how, any ideas that you already are implementing, or ideas that you could put into place to help support people after the class, if that's, to the extent that you're able to. And now that I think about it, I can also ask NCOA if they have heard of other strategies for that. So that's it for me.
Good. I want to just call out and see if Renee has joined us on the line. Is Renee Callanan on the line yet?
Hello, can you hear me?
Yes, is that Renee?
Can you hear me? Hello?
Yes. Can you hear us?
Hi, this is Renee.
Oh, yay, great. Well, I kind of thought I heard some clicking going on as if you joined the call, so I wanted to be sure that we get you introduced and get you on our agenda and going. So happy to have you join us at this meeting. And also, Renee, know that this meeting is recorded, both as a webinar and we take minutes. So if anyone who is not here today, they're going to be able to access this webinar once we post it on our statewide website. So it'll reach a wider audience than even who we have on the phone today. So we welcome you, Renee Callanan, correct?
Yes.
And Renee,
Thank you.
why don't you, is there anyone else on the line that has not yet introduced themselves to be part of the meeting that I didn't catch earlier? Just want to be sure I didn't skip someone. All right, so Renee, I'm going to let you introduce yourself, and you would like for me to pass this over to you, correct? As a presenter.
Yes.
Okay.
Yeah, so I can pull up my slide.
So change presenter to right there.
Okay, so do that. I can introduce myself. I am Renee Callanan, and I am a chronic disease epidemiologist. I work at the State Health Department, Colorado Department of Public Health and Environment, and I've been working with all of the chronic disease program areas there for the last 6 years or so, and yeah, I mean, that's about it. I am a seasoned employee assigned here through a small program to increase chronic disease epi capacity. It's not a limited position. As I said, I've been here for 6 years, and sorry, I'm multitasking, trying to get my slides. So I like when people put their little picture on their slides to make the left. I am an officer in the U.S. Public Health Service, Commissioned Corps, and that's one of the 7 uniformed services of the U.S. Under the U.S. Surgeon General. So any questions before? It seems like people are able to speak. Not everybody's muted. Correct?
Correct. They have the option to go back and forth.
And this is Connie. I'm having a little bit of, I can hear you, but it breaks up sometimes and seems to have some background noise. I don't know if there's any solution to that, but just wanted to let you know.
Okay. Is there?
Not yet.
I'm working through the microphone of my computer, so I should.
Mary Pat, could she call in on the phone? Would that work? Or do you think that would be better?
Yeah, she can. Do you want to call in on the phone line, Renee, as well? Or do you have access to do that?
I can. Just myself.
Yeah, it's really, sorry, it's really not that good a quality.
Or would there be any feedback?
Is that posted on here?
I'm sorry, I didn't hear your question.
Okay. Well, yeah.
Okay, Renee, do you need the number?
Yeah, I was going to try to pull it up.
Yeah, it's I can give it to you.
Okay.
It's 571-317-3131. And then your access code is 779-259-517. And that should give you audio over the phone.
779-259-517.
517.
Is this any better?
Does she have to turn off her? Yes. You'll have to be sure and turn off the audio on your computer. Otherwise, we're getting like an echoing feedback.
Okay, where do I do that? I'm very sorry.
Let's see. Can she just go down to volume and mute? If you go down to the right-hand corner and click on your volume button and mute it, maybe?
Not working because I can't get out of my slides here.
If you have a mic plugged in, can you just unplug that?
I don't have one plugged in.
Yeah, that's getting a lot of feedback.
Renee, is it possible, I don't know if this would work, if you're on a mic that you have plugged into your computer, could you just unplug that?
I just have a laptop and it's not a separate mic. I don't know why it won't let me get out of PowerPoint.
Should be able to get your bottom panel showing up with your volume button and click on that. Otherwise, we can just go back to your computer if you want. At least it was workable.
Okay, is this any better? No,
we
it's
get
still
an
echoing.
echoey sound.
Yeah, because I did the F8 to turn off the microphone. Not seeming to. Do you want me
for
to
the sake of time, if you want to just click back to your computer mic.
Okay.
Are you there?
Okay, is this okay?
Yeah, we can hear you.
Okay. I will try to speak. Okay, let's get going. Actually, I think the whole thing is frozen, and that's why.
Here you are.
Oh, there we go. It's just slow. Okay. Okay. So I was asked to give a presentation today about chronic disease in Colorado, the data by age and by geography. And then also to give some information about that you can access in addition to the data that I will provide. And so that's my first day of to maybe quickly a couple people could they would like to get out of the next what they'd like to learn from presentation of the use.
Well, this is Mary Pat, and I probably would like to, I'm most interested in the trends of what we might see ahead of us, say in the next 5 years, if there's any trend that we can kind of begin to be aware of and plan for.
Okay. Now, have any areas of focus, specific questions? All right, well, I'll just go through, and then you can stop me if you have questions, and there's slides. I'll just warn now to be comprehensive, and thing that the slide set could serve as well. And so some of them I'll be going through a little quickly, that the slides will be able for your reference later. So I just wanted to first set the stage a little bit and talk a little bit about data and why data is important and how you can use it. So public health surveillance is the ongoing systematic implementation of processes, and it goes from data collection all the way through dissemination of the data and subsequent that information of surveillance data and why surveillance is important. For this presentation, I did want to make that your data can be very part of an evidence-based public. Slide shows one model of using an evidence-based public health approach, and I like this one. It's adapted from the county health rankings, and it's from the CDC website. This shows all the partners involved in the middle and evidence-based public health approach, from assessing needs and resources. That includes looking at the data, doing a needs assessment, and getting input from the community, as well as looking at other surveillance type of data to look at the burden and the disparities. I see someone is having a hard time hearing, but I'm just not sure what to do about that. When other people talk as well, it's choppy for me, so I don't know if it's my computer or the GoToWebinar system.
Yeah, I'm not sure, Renee.
Is the problem that
I mean, it got easier to hear you, right? Just the last few sharing. So unless we want to retry getting on the phone.
Well, is it the volume or is it choppy?
It's a little bit choppy, like it sort of comes in and out a little bit, which might be the computer mic is likely what's happening.
Right.
Do you want us to try to walk you through turning off that mic and getting back on the phone? Or do you want to just continue?
Working. Here. If I turn this.
I mean, we
I'll
can
try
hear you.
one more time on the phone. I'll try to be quick.
Okay, do you want to? Renee, it might work if you go down to the very far left corner where you would normally shut down and can see all your information. So, and we're going to open the control panel, which, yeah. And we should be able to find the mic in here, and we should be able to close it from this point. So it may be under, could be under mic, it could be under volume or sounds. So yeah, far left should be your sound. Let's see if we can find a microphone. And we'll just try to close that out.
What do I do here?
I would take that all the way down, and I'd take the other one all the way down also. See if it will actually go to mute. So next, yeah, there we go. Are you on the phone, Renee? So we're not hearing you now. I bet if you go to the phone. There you go. We'll give her a second to get it back on.
Okay, can you
that
hear
might be Renee.
Can you hear me?
Yes.
Okay.
Hooray. Yay. Thank you.
Okay. I'm very sorry.
No, that's
all right. So I'm going to try to move more quickly through the introduction here so we can get to the data. I had this slide here that shows the CDPHE's health equity model. I hope you're not hearing the echoing that I hear. So this shows that across the life course, various determinants of health and other health factors influence population health outcomes. And so this is just a prompt for me to remind you that we do have data across the life course for all of these different factors, from economic opportunity, physical environment, social factors, things like that. But this presentation really focuses on the outcomes, so diagnosis of disease, and whether or not you consider hypertension and high cholesterol a risk factor or condition or an outcome. That's also included. But we do have data on mental health and access and quality care, but for today, I'll be focusing on those health outcomes. Okay, it's not moving. Full of technical difficulties today. There we go. So at the beginning, Mary Pat said that wanted to look at projections, and this slide was considering that the population is aging, and this graph shows the population by age group in the United States from 2012 through 2050. So the population aged 65 and older is projected to increase through 2030 and then level off, and that's nationally. Over 20% of the population will be aged 65 or older by 2050. So if that population is increasing, then concomitantly, the population aged less than 65 is projected to decrease. This graph is Colorado data, Colorado projections of the population aged 60 and older, and this estimation is that the population will increase greatly through 2040, and those population totals are projected to be 1.8 times the number in 2015. And I said I wouldn't focus on access to care, but this is just a slide to show that we have maps at the health department of health professional shortage areas, and they are defined as geographic or low income. So this is just part of the context of the issue, that the population is aging. We have health professional shortage areas, and this map shows where those are. Related to that, we have maps of medically underserved areas and populations. So in the orange is medically underserved areas, and in the green is medically underserved populations. So again, just part of the context and things to consider as you're planning, whether it's expanding new programs or whatnot. Here's one of your maps of chronic disease self-management programs and the reach of those in locations across the state. And then these are the locations where the classes are currently offered with points. So after I show the disease burden by region, it'll be interesting for you to then go back and compare them to these maps. Looking at chronic conditions among adults in Colorado, we estimate that over 2.2 million adults have one or more chronic conditions. That's about 56% of adult Coloradans have at least one of 9 chronic conditions, which I'll describe in a minute. Of those 2.2 million, about 780,000 of those are adults aged 60 or older. And then again, for context, from 2012 to 2015, the chronic disease self-management courses had 3,300 attendees and about 2,300 completers. So about 800 course completers per year in Colorado on average. Just something to think about in terms of reach, and I'll come back to that point later in the presentation. Now I want to get right into the data here. The main data source that I'll be presenting is the Behavioral Risk Factor Surveillance System, called the BRFSS. It's a national population-based telephone survey, and it's been conducted continuously since 1990 in Colorado. We conduct it either in English or Spanish. And in 2011, we began calling cell phones, and not just landlines, and we improved the survey weighting methodology to more accurately represent this population as a whole from the sample that we get in this telephone survey. However, note that with this change, we do want to use some caution when we're looking at trends pre-2011 and then after this change. We actually didn't see huge changes in the prevalence of disease. The main area that we did see a change after this 2011 update to the data collection and the weighting of the data was in binge drinking. So some different behaviors did see either a jump or a little bit less prevalence because of this improved methodology. But we did not see big changes in the disease outcomes. So the BRFSS has CDC's core survey, and that's where we find the questions on the prevalence of disease. And we can compare to other states and nationally because all states use the core survey. Here's just a list of all the different types of information we collect from the BRFSS. And this gives you potentially some ideas of other things that you might want to look at. The conditions in red are the data that I will be presenting on today, but you might want to look at these conditions and cross-tab it with some of the other conditions like well, obesity and diabetes or something like that, or by different demographic factors other than age and region of residence. This graph shows the trends of selected conditions among adults. And you can see a lot of them are kind of flat. High cholesterol and diabetes actually did have statistically significant increases over this time period. And current smoking actually did have a decrease, but the other ones have been relatively stable. Oh, obesity did also increase. Sorry I missed that one. So high cholesterol, obesity, and diabetes did have a statistically significant increase over time. Now I want to define the different chronic conditions that we're looking at. On the BRFSS survey, we ask people, has a doctor, nurse, or other health professional ever told you that you had, and then they ask separately each one of these conditions. So they ask if they've ever been diagnosed with cancer, and they ask skin cancer separately, and then any other type of cancer. So for this presentation, I did not include skin cancers. Excuse me. And then all of the other conditions, and then just note for high blood pressure and diabetes, we did not include pregnancy-related conditions only. So if they said that they only had that during pregnancy, we did not include it. And then for high blood cholesterol, that is that if a doctor ever told them that they had high cholesterol, among those who said that they have had it checked. If they said that they have not had their cholesterol checked, then they're not included. And then finally, of those 9, we created another variable that said, well, do they have any one of those? So any chronic condition. And that's the data that I presented in one of the previous slides, about 56% of adults having any of these 9 conditions. Now we'll look at the overall prevalence. So this shows the prevalence of stroke is about 2% among adults aged 18 and older. And of these 9 conditions, the highest prevalence was high cholesterol at about 35%. About 1 in 4 also, they had been told that they had high blood pressure, hypertension. That's what HTN stands for here. Next, we look at the prevalence of these conditions by age. So the prevalence of cancer increases with age. For each of these slides, I I set a standard axis from 0 to 60 so that you can also get the relative prevalence across the diseases. So the prevalence is highest among adults age 65 and older at about 17%. I did not include myocardial infarction or heart attack in any of the other data, but I did throw it in here just so that you could see that we do collect those data, and it is similar to the data on coronary heart disease. Again, the prevalence increases with age. For the younger populations, it's just too low to report. This slide shows the prevalence of stroke by age, and of course, again, that increases and is highest among the adults age 65 and older at about 5%. The prevalence of high blood pressure, again, increases with age. This is a little bit more prevalent among even the younger age groups, increasing from about 8% among the youngest 18 to 24-year-olds to 57% among 65 and older. Very similar graph here for high cholesterol. Again, clear increase with age. And then this is asthma by age, and you don't quite see that increase with age. It's relatively the same at about 8 to 10% across age groups. Here's the prevalence of arthritis by age. So there are 13% of 35 to 44-year-olds and 24% of 45 to 54-year-olds who have been told that they have arthritis. But again, clearly increasing with age, and just over half of adults age 65 and older have been told they have arthritis. There's the prevalence of COPD, and lower prevalence overall, but still about 10% of older adults have COPD. And then diabetes. So overall, about 7% of adults have diabetes, but that increases to about 16 to 17% among those aged 65 and older.
Hi, Renee. I'm going to slow you down just a little bit. We're having a little bit of trouble keeping up with your slides, I believe. Can you try to go to, in your PowerPoint, the far left side where on the bottom where the arrows are? Maybe try clicking those instead of your arrows on your computer.
Good to go. You mean
so head down to where it says so that you're very far. Keep going down now, left corner of your PowerPoint on the white. On the white, yeah. Try hitting that arrow.
Okay.
Sorry. Thank you.
Sorry, for me, I thought that it was advancing properly.
Yes, that's what we thought over here also.
Okay, so this slide is just talking a little bit about prevalence and brings up a couple of issues when we're looking at the data. Some things to think about. Prevalence is defined as the percent of a population that is affected with a particular condition at a given time. So we have what I just presented and what is usually presented as the crude prevalence. It's unadjusted. It's the actual prevalence. However, there are some times that you'll see data that says that it's an age-adjusted prevalence. So sometimes that's done to compare different populations, and sometimes those populations differ in age. So one area or one subpopulation by a demographic factor might have a higher prevalence of, say, diabetes because they're an older group. So if you want to take away that difference in age, you can adjust for age and look at the prevalence that would compare the populations as if they had the same age distribution. I debated about which ones to present for this, but I did end up just presenting the crude prevalence so that you have the actual prevalence in different areas. On this slide, it also mentions the age-specific prevalence, and that's kind of what we just went through. So the prevalence of diabetes by age. So it's just something to think about when you're looking at data on other websites or in reports. If they're adjusting for age, it's not the true prevalence, but it's useful in comparing different populations to see, if they had the same age distribution, what does the prevalence of that disease or condition look like? And then a note about the burden. So when you're planning programs or trying to target different populations, it's important to think about what your goal is. Are you trying to reduce the overall burden or to impact the whole population? Or are you trying to reduce disparities? And that's important because there's different ways to look at the data. And if you're comparing prevalence, you're comparing the percent of the population with a condition compared to looking at the total number of population with that condition. So the population might be if it's a high population with a low prevalence, such as in the graph here you can see El Paso has a high population but a lower prevalence of having one or more chronic conditions. Huerfano County has a much higher prevalence but a low population. So both points are very important in their own right. So you just have to decide in targeting different areas whether you want to focus on reducing those disparities, so the places where there's a high prevalence, or if you want to have a high reach and have an overall impact on the population, you might also choose some populations that might not necessarily have a high prevalence, but there's still a high number affected. Oops, I didn't use my arrow. Hopefully the slide advanced. Here's a map of how we break up the state in terms of regions. These regions were selected several years ago because they are relatively similar in terms of demographics and some health outcomes, and it's just a way that we can get sub-state level data from our surveys. So some of the smaller rural counties like Hinsdale. We might not have enough data from them from our survey to be able to reliably report on that one particular county. So we group some related counties together and so that we can get some sub-state level data. So these are the regions that the next set of slides shows the data for each region, and so that is just how they look. And I have a smaller version of this on the slide for your reference. But then when you go, if you go back and look at these, you'll have this as a reference too. So I created one slide for each region, and it shows the results of those 9 different chronic conditions. And I should have said before, I don't really like rankings, but in this case, it was the easiest way to present the data. 2 regions or even 10 regions could be very close in prevalence, and the ranking doesn't really mean as much. That's my main issue with ranking. But when you're looking at these slides, don't focus on the number, the exact rank, and oh, this region was 1 and this region was 3. It's somewhat arbitrary, but it's just something to compare the different regions. And the overall rank is decided by taking the 9 conditions, and a number 1 rank is the least favorable. So 1 is worst, and 21 is the most favorable or best. And the overall rank is just looking at all 9 of the conditions and saying which region scored the lowest on the most of those 9. So it's just comparative, and as I said, this is just in relative terms, and please don't focus on 5 versus 6 or anything like that. It's just to give a sense of how that region is doing in terms of chronic disease. So region 1 is the Northeast. So it includes a group of counties up in the Northeast. I think there's 6 counties in region 1. And it has a higher burden of chronic disease compared with other regions in Colorado. The overall rank is about 6. This spider chart or radar chart in the middle here, the main chart here, shows the rank for each of the different conditions. So if the blue line is more towards the outside of the chart, then it's worse. So region 1 is ranking worse compared to other regions, especially in diabetes, cancer, coronary heart disease, and stroke. They're doing a little bit better in terms of asthma. So that's the summary of this region for those different conditions. And as I was just previously mentioning about prevalence versus the population numbers, on each slide in the lower right-hand corner, I've also put in our estimated population in region 1 with 1 or more chronic conditions. So in region 1, there's about almost 32,000 people with a chronic condition. So any questions about how these data are presented here? because I'll go through relatively quickly for the rest of the regions and just highlight some interesting things and leave the rest for you to review as reference. Questions?
Renee, this is Mary Pat. And is this slide current and accurate, or was it a sample slide? The Region 1?
No, this is actual Region 1 data as far as their rankings on those different conditions.
Okay, great. I'm actually writing down this information. I go tomorrow to talk to a group of leaders who are just completing the chronic condition training along with diabetes training. And I think this will be really good information to share with that group, you know, as they now go out and potentially lead classes in this area, right in that very area. Thank you.
Great. Oops, keep forgetting to use the arrow. Okay, hopefully everybody sees Region 2 now. Region 2 is Larimer County. They're doing a little better in terms of chronic disease than some of the other regions. So should say that since there are 21 different regions, I kind of arbitrarily said that the top 7 are high burden, then the next set of 7 are kind of moderate burden, and then the last set of 7 are low burden. But as you can see from that spider chart in the middle, they don't have a lot of low rankings, or, you know, the number 1 is being the worst. So they're actually doing better in terms of hypertension, high cholesterol, arthritis, and diabetes. But then again, if you look at the population with 1 or more chronic conditions, there's about 122,000 people with a chronic condition in Larimer County. So that was higher than in Region 1, where there were about 32,000. So if you're planning across the state, these are things to think about. As we usually see, Douglas County is a low burden county in terms of chronic disease. The overall rank here, about 20 out of 21. So they're doing much better in terms of coronary heart disease, stroke, hypertension, arthritis, COPD, and diabetes. Now we have the Eastern Corridor. And then again, you see this is more of a high burden region. Overall rank of 5. You see more points on the outermost portions of this little spider web. They do a little worse than other regions in terms of stroke, hypertension, high cholesterol, arthritis, COPD, and diabetes. And there's about 19,600 with a chronic condition in this region. And then we go to the southeast. This has an overall rank of 1, which is the least favorable. A higher burden of chronic disease here, ranking worse than most other regions in all 9 of the conditions that we're looking at. Region 7, just next door, Pueblo County here, has an overall rank of 2. So again, another high burden region. San Luis Valley. Again, because of our arbitrary cut points, it says that there's a moderate burden. because they weren't in the top 7, but significant labor in stroke, hypertension, high cholesterol, arthritis, and COPD. Doing a little better than other regions in terms of cancer and asthma, though. And then the Southwest, you can see they're doing better in a few diseases and doing worse, so they're kind of moderate here. I'm going to start going a little faster just in terms of time, but if you want me to go back to any specific region, I'm happy to. West Central is another moderate region. The Northwest has a lower burden. They're doing better than other regions in a number of areas. And then the same again with the Western Corridor. Region 13, which we call South, has a higher burden. This one's ranked number 3. There's Adams County. Arapahoe County. They're both kind of moderate, but they do have a couple of conditions where they're ranking worse. Boulder and Broomfield, lower burden. There's Central. There's an overall rank of 4. So higher burden here, especially in ranking low here in cancer, COPD, arthritis, asthma. Weld County, actually, when you're looking at the individual conditions, compares favorably to the other regions. They do still have a population of over 97,000 with a chronic condition. There's Mesa. Higher burden here, but ranking very well in terms of high cholesterol. There's Denver. Diabetes would be an area where they're doing worse. And Jefferson has a moderate burden compared to other regions. So that was all the regions separately. I wanted to try to figure out a way to summarize it visually. So the darker cells here in this table show the 7 least favorable rankings, and then the medium purple is the next set of 7, and then the very pale purple is the best 7. So you can see that really the top 7 are very similar across. Southeast, Pueblo, the South region, Central, Eastern Corridor, Northeast, and Mesa. And then so that you can see the population with 1 or more chronic diseases right next to it here. That's on the right. So the 7 regions with the highest burden here do have lower populations. That's not too surprising because we do see the more rural areas having a higher burden. And then again, the map, just to make sure, because I don't know how familiar you are with these regions. We do report out this way a lot, but just to make sure. So again, region 6, 7, and 13, those were the the highest burden regions, and then 1 and 5 here up through the east. Okay, so in the interest of time, I'm actually probably not going to be able to get too much to the data resources, so I'll just spend a couple more minutes on the data and then ask if there's any questions, and I'll leave the resource slides for you. I'm sorry I didn't get to them. This map shows the prevalence of 1 or more chronic conditions, so of those 9 that we've been looking at, by county. So I know everybody would prefer to have, you know, this lower level data of county and not have to aggregate into regions, but I wanted to show that when we go to the county level, we do have to suppress some of the county data because we just don't have the numbers to report reliable prevalence. But you do get the county level data for most of the counties. And then this is when it's aggregated up to regions. So you can look at the difference to compare what happens when you aggregate. But it still does show kind of the same areas that where with those hash marks, diagonal hash marks, that well, they're statistically higher than the state. And so it is that southeast region in Pueblo that, and even through what we kind of call the south, where they have the highest burden. So I think there's a typo here. I think it's supposed to be 56% of adults live with 1 or more chronic conditions, and the trends in these chronic conditions are mostly stable, but they're increasing for a couple, definitely not decreasing. And the prevalence increases with age for most of the chronic conditions. The regions of the state where there's the highest prevalence include the south and southeastern regions, including Pueblo County. So I think I need to stop there. Take any of your questions.
Renee, this is Connie from the Department of Human Services, and I don't have a question, but just a comment that this kind of data can be used by any of the folks on the line, both for planning, you know, how to use limited resources in the areas where they're most needed, as well as justifying, you know, your existence, additional funding, et cetera, to show that where you rank on the burden list, and just looking at some of this data that Renee's presented is great background information for demonstrating the need and explaining why your programs would be valuable to residents of those areas or with certain conditions that are shown on the map. So I appreciate that data, Renee.
Great. Yeah, if you can reach out to me if you want something a little different, like presented a little differently, or you have a question about any of the BRFSS data.
Hi, this is Melissa from Boulder County. I don't know if you have time for a question, but I had two things I wanted to ask you about. There was one slide that showed that 56%, I believe it was, of adults in Colorado have at least one, people over 18 have at least one chronic condition. And then when the slides weren't advancing, there was something about 89% of people have chronic conditions, and so I was sort of confused about what those two numbers were. And the other question I had is about whether you are going to consider obesity as a chronic condition, because I know you mentioned that a couple of times about obesity.
Yeah, so it's based on my audience, how I define it, and the input that I got was that these 9 conditions were what the programs that you and the courses that you teach are focused on. And so
that's correct. Yeah, I just don't know that that's becoming such an issue, and I thought it was considered a chronic condition, so that's why I just wanted to ask about that.
Yeah. Sometimes I do include it together, but I just didn't for this presentation.
Okay, thank you. And what about that 89%? Do you know which slide I'm talking about on that one?
Really?
No. It was during the time they weren't advancing, right? So you were breaking it down by chronic conditions. So you had like arthritis, you had cancer, you had.
This side?
Yeah, so keep going on that, because somewhere on there was an 80%. It was towards the end of that portion of your presentation. And it went quickly, so I might have misread it.
I'm not sure what.
Yeah, I think I must have misinterpreted something somewhere along the line.
Well, when Mary Pat posts this presentation, Melissa, you could go through and when you have a little bit more time, look for that number and then email Renee.
Okay, thank you.
I was also wanting to ask Renee, a lot of this data is available on your website, right?
Yeah, I'm sorry, I was part of the technical difficulties, and then I was probably just going too slow without realizing it. I wanted to get to the second piece of the presentation, and I'm happy to come back if you want me to. But the additional data resources, I was highlighting our older adult 2011 report called the CASOA Community Assessment, and then a lot of CMS data. And
is that slide 64 that has I see real small CMS, or that's just CMS data online?
And then I have some related
and down there, yeah,
resources here. So you can.
Those are really helpful. I've used those for other things that I've done, and for trying to find something, for example, on obesity, it might be possible. Well, you could tell if it is or not, Renee, but to do a search on specific conditions. I don't know if that's actually possible, but is it?
I just don't do it that way very often.
Oh, okay.
So
okay. Sorry, I
you
thought
might
maybe
be able to get it, but I'm not sure what really comes up if you just search for obesity. For obesity, I can tell you that we have in our Facts for Action fact sheet series, we have one on childhood obesity. We also have one on fruits and vegetables. And then we do have a new infographic on obesity. If people have time, I can navigate to the website and show you.
Or could you send it to Mary Pat, and she could distribute it when she sends out the minutes and the link?
Sure.
To the webinar.
Yeah. Yeah. Are there any other specific things that people would like links to? I'll send the link to the obesity infographic and the child obesity fact sheet.
Maybe that chronic fact sheet. The other thing that I found really helpful was your chronic disease state plan. That might not be the exact title, but do you know what I'm talking about?
I think so. The state plan is Yeah, I can send a link to that.
Okay, that's got a lot of good information.
And the other
So Renee, this is Mary Pat again. Does that wrap it up for you?
Okay.
Or any other questions for Renee before we disconnect her? Again, I just want to remind everyone that all of these slides, her full presentation, are going to be available on the webinar posting once it goes up, like was mentioned, and so we'll get that on Self-Management Colorado. And we certainly thank you so much, Renee, for your valuable information. And even though we had a few glitches as we went through it this morning, all that information has been captured. You've given a good explanation of some of the stuff that you have available, and I think it's a great resource and tool for all of us to take advantage of. Very, very interesting to look at our state from county to county and condition to condition. So thank you so much.
Yeah.
Any last questions for Renee? All right, I'm going to switch presenters now. Back to me. Just so you all know. And I'm clicking through our slides. Just a quick review of our statewide trainings that are coming up. Starting in 2016, if anyone has a training scheduled, or as soon as they do, please let us know. Show my screen. Click it. All right. And after that, I think the only thing I want to we did talk about some future agenda items. I think Connie has already mentioned a few of those. If you have something in mind that you would like to see us discuss, please don't hesitate to send us an email and we'll get it added to the list. I know Melissa gave a suggestion about how license holders are handling resource materials attached to a class before, during, after, etc. So that'll be a good topic to discuss. And our next meeting, Thursday, December 3rd, it looks like we're going to look at trying to get Sally Thorson maybe to share, and perhaps Melissa and I and even Holly could share a little bit about a collaborative effort that we've been involved in that's been successful. And we can share a little bit on that agenda day. And my last thing, I just want to be sure and remind everyone that it is our COA's last meeting next month is December, and we had committed to chair this. This is our 3rd year, and we was definitely looking ahead to stepping down from that role and allowing someone else to chair these monthly meetings. So please keep that in mind so that we have some plan for January and who's going to be running the meeting. And other than that, I think that's all I have. Any last minute questions before we say adieu? Because I know we're over time. All right, I am going to officially close the webinar and stop the recording, wishing everyone a wonderful Thanksgiving season as we're approaching that. And wow, we'll meet in a month and it'll be Christmas time almost. So take care all. I'm going to stop the recording now.